Calcium channel blockers are a class of drugs that affect arterioles and cardiac tissue, including the heart's intrinsic conduction system. They work by binding to and blocking L-type calcium channels located on the cells of these tissues. This impedes the flow of calcium into these cells, which is essential for maintaining the tone of arterial smooth muscle and regulating the contraction and conduction of nerve impulses of the heart. As a result of its mechanism, calcium channel blockers induce the relaxation of peripheral arterioles, which ultimately leads to vasodilation. When it comes to the heart, they have a negative inotropic effect, which reduces the contraction force of the myocardium, and a negative dromotropic effect, which slows down the velocity of conduction, thereby decreasing heart rate. There are two main types of calcium channel blockers, non-dihydropyridine and dihydropyridine. Calcium channel blockers that fall under non-dihydropyridine work on cardiac tissues and arterioles. Examples of these are verapamil and diltiazem. Verapamil mainly targets cardiac tissues, while diltiazem has a more balanced effect on both. On the other hand, dihydropyridine calcium channel blockers primarily work on arterioles. Examples of these are amlodipine, nicardipine, and nifedipine. Dihydropyridine calcium channel blockers are easy to memorize because they end in dipine. Non-dihydropyridine calcium channel blockers can be helpful for treating tachyarrhythmias stemming from above the ventricles, such as supraventricular tachycardia, atrial fibrillation or flutter, and symptomatic premature atrial contractions. This is because they block the depolarization of the SA and AV nodes. In addition, non-dihydropyridine calcium channel blockers can be helpful for stable forms of angina pectoris or as a secondary option for transmittal angina when beta blockers are not an option. This is because their inotropic and dromotropic effects reduce the heart's need for oxygen, while their ability to dilate the coronary arteries enhances blood flow. Both non-dihydropyridine and dihydropyridine calcium channel blockers can be used to treat hypertension. However, dihydropyridine calcium channel blockers are more effective because of their selective impact on arterioles. Dihydropyridine calcium channel blockers are also used for Raynaud's disease, cerebral vasospasms, and pulmonary hypertension. Lastly, it's worth mentioning that verapamil is occasionally prescribed for the treatment of migraines. When administering calcium channel blockers, it is important to be aware of potential complications. Non-dihydropyridine calcium channel blockers can cause bradycardia and heart block, whereas both types of calcium channel blockers carry a risk of hypotension and reflex tachycardia. However, dihydropyridine calcium channel blockers present a greater risk of this. Calcium channel blockers can also cause orthostatic hypotension. Therefore, it's important to be cautious when standing up, particularly if you're beginning to take them. This will help prevent falls and episodes of syncope. Another complication of calcium channel blockers is peripheral edema. This occurs due to vasodilation, causing increased permeability of arterioles. Although a doctor may adjust the dose to alleviate the edema in some cases, the benefit of taking a certain dose may outweigh the side effect. However, wearing compression stockings and elevating the legs several times a day can help. Vasodilated arterioles close to the skin can also cause flushing. Other complications of calcium channel blockers include constipation, headaches, and gingival hyperplasia, or an overgrowth of the gums. And lastly, specific to verapamil, it is important to note that hyperprolactinemia may arise, which results in gynecomastia in men and galactorrhea and menstrual irregularities in women. It's important to note that there are certain situations where the use of calcium channel blockers should be avoided. For instance, individuals with Wolff-Parkinson-White syndrome should avoid them, as they can potentially trigger dangerous arrhythmias, like ventricular tachycardia or fibrillation. Calcium channel blockers should also be avoided with heart block, as they may worsen the block. Moreover, taking calcium channel blockers, especially non-dihydropyridines, along with beta blockers should be avoided, as the combination could increase AV node blocking. In cases of decompensated heart failure or aortic stenosis, calcium channel blockers should not be used, as they could worsen the situation by decreasing cardiac output. Lastly, calcium channel blockers should not be used when experiencing hypotension. And finally, there are a couple of special considerations to consider regarding calcium channel blockers. It's crucial to note that when taken with digoxin, some calcium channel blockers, such as verapamil, can heighten the risk of digoxin toxicity. Additionally, it's necessary to avoid consuming grapefruit, as it can elevate the medication's concentration in the bloodstream. And finally, in cases of need, calcium gluconate or chloride can serve as an antidote. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!